Hello, my name is Ashley Valeria. I'm going to be talking about Chapter 6, Domain 3, the diagnostic and monitoring function of the nurse. Objectives: describe the nursing domain of the diagnostic and monitoring function, identify the 5 competency of the domain, discuss exemplars and personal examples of each competency, describe the significance to professional nursing practice, patient care, interdisciplinary teamwork, and patient safety. Domain 3 is the diagnostic and monitoring function of the nurse, which is a very essential role. Nurses have to carefully monitor therapeutic interventions they perform due to the narrow margins of safety of those interventions and treatments, such as patients receiving chemotherapy. The nurse has to really closely monitor the patient with chemotherapy to see if that medication is more toxic to the patient than it is curing or controlling their cancer. It's seen as the patient's first line of defense, and constantly monitoring the patient and assessing the patient helps pick up the first clue of complications. The first competency is detection and documentation of significant changes in the patient's condition. So you have to have measurable vital signs and clear observational data to clearly document them and present them as a firm and convincing case that there are significant changes to the patient's condition. It's a frontline assessment of the nurse, which is central to the optimal care the nurse provides for the patient. So an exemplar 1 on Benner's book on page 98 explains about a nurse who was having a strange feeling about a patient, and she didn't take any vital signs, she didn't do any focus assessments, she didn't do any documentation about the patient, and she was asking the doctor help to take care of the patient and asking other nurses help to take care of the patient, and they didn't really understand how they can help her take care of the patient if she never took any recent vital signs, if she never had any recent documentation of the patient. So thereon, she learned that there needs to be clear documentation of vital signs and observational data so that there can be a convincing case that if there's something wrong with the patient, the physician agrees and there is something done for the patient quickly. And then a personal example I can provide is when I had a patient who was a post-status fall as a student nurse the night before. He was experiencing orthostatic blood pressure, and I was supposed to give the patient medication the day after as a student nurse, and I saw that his systolic blood pressure was in the 110s. However, his heart rate was less than 60, and the blood pressure medication doesn't have any hold parameters. So I went up to the doctor, I documented the recent vital signs I did. I presented to him the vital signs I took and the orthostatic blood pressures that the patient was receiving patient was experiencing the night before, and that convinced him to withhold the medication, which would have prevented complications of the patient. The second competency is providing an early warning signal, anticipating breakdown and deterioration prior to explicit confirming diagnostic signs. It explains that the nurse picks up subtle changes in patient's behavior or appearance with monitoring the patient. Early detection of arising complications is needed. It needs advanced recognitionable ability of subtle changes, usually by expert nurses, and it's linked to the nurse's skill in getting appropriate and timely response from the physician to be effective. And then so on page 101, Benner provided an example of a nurse who was having a patient who was post-op cholecystectomy. He was already discharged, but the patient had to come back because she was having a weird drainage from her wound, and they put the patient on antibiotics. And the nurse just had a weird feeling about the patient. She has been monitoring her vital signs, and her systolic blood pressure would drop I would say like 2 points every time she took her blood pressure, and she had a bruising on her stomach, and the patient was just having a weak complaint that there's just, she doesn't feel right. So the nurse knew right away there's something wrong with the patient, and she had to convince the doctor on call to come assess the patient. And it turns out that the patient was on strong antibiotics and it led to resistant bacterial flora, and that led to vitamin K deficiency. She was having internal bleeding. So therefore, if the nurse never catched those subtle changes of the patient, or convinced the on-call doctor to come in, there could have been worse outcomes of the patient because she was experiencing internal bleeding. And then a personal example I can give is when I worked as a tech on the emergency department. I had a patient with schizophrenia and obsessive compulsive disorder, and I've had this patient plenty of times. And I know there are times where he is calm, but there are times where the patient gets out of behavior. And I was observing the patient, and he was fidgeting with his fingers and changing positions on his seat. So I knew something was, going to be wrong. And I figured out that the patient had a BM on his underwear, so I helped him change his underwear because he couldn't by himself, and I gave him a snack to calm him down. But it was very important for me to pick up those subtle changes of finger fidgeting and like switching position in seats, because that helped me prevent him get out of behavior where he could be a danger to himself and others. So the third competency is anticipating problems of future thinking. It explains how expert nurses spend most of their time thinking about the future course of the patient, and it needs anticipation of future potential problems. It's a retroactive description of past shift report and forward looking. And it explains important details on how their shift went and what they could have expected for a future course of the patient could be. So exemplar 1 on page 103 explains on how an expert nurse thinks about a patient before she receives the patient. So before she gets report, she thinks about what kind of past medical history does the patient have? What kind of surgery is the patient going to receive? What kind of support system does the patient have to determine what kind of complications the patient can have? And if she determines that a patient can have a hemorrhaging as a complication, she can have mixed drips of medications ready on the patient's room. So if the patient does experience the hemorrhaging, she's not wasting time mixing those drips. She's giving the medication right away. And then a personal example is retroactive past shift report I received when I was a student nurse for a patient with COPD. I received the shift report that he was angry and rude to the staff members, and that helped me figure out how I can approach the patient so that he can comply with the medication I was going to administer to him and not be so rude and angry and comply with the treatment. Okay, so competency 4 is understanding the particular demands and experiencing illness and anticipating patient care needs. So it explains how monitoring the patient's characteristics and coping style helps understand the patient's interpretation of illness, their needs, and minimize anxiety and maximize their recovery. So exemplar 1 on page 105 explains how an expert nurse usually gets patients with ulcerative colitis for surgery. She says that they are more compulsive in a way where they focus more on their changes on their body. So she explains that she needs to have a more detailed education explanation of procedures and interventions, because that's what the patients will ask for. And that helps out figure out like the disease or diagnosis the patient has, helps figure out what kind of treatments and cares and needs the patient can have as well, just by monitoring the characteristics and coping styles that they have. And then a personal example I can say is when I was in rotation as a student nurse in the mental health unit, knowing the type of diagnosis the patient has, like generalized anxiety, major depressive disorder, helps me figure out what kind of coping styles and techniques I can offer to the patient, like deep breathing and journal writing. 5, it is assessing the patient's potential for wellness and for responding to various treatments and strategies. So it's assessing and monitoring the patient's potential for wellness serves as an individualized guide for treatment and strategies and goals, looking at their beliefs and their illnesses and how they respond to treatment. Once it's obtained, nurses must document it and report their respectives of their potential for wellness and advocate for the patient. So to further explain, on page 106, it provided an example of a nurse in a psychiatric unit receiving discharge plans for a patient who just got to the unit. And the doctor did not think that that patient had a potential for wellness or to comply with treatment, but the nurse knew that she could. So she convinced the doctor to assess the patient a little more, and the doctor got to see the nurse's perspective on that patient, that the patient can comply to the treatment and she should stay longer. So a personal example is going back to competency 3, where I had that patient with COPD. I knew he was complying with the treatments and medications I was giving to him because I approached him a certain way. So I told the nurse before leaving, and then so that she could tell the night shift nurse how to approach him to increase his potential for wellness to comply to the treatments and interventions and medications given to him. Significance to professional nursing practice. So on page 95 on Bender's book, it states diagnostic monitoring function of the nurse has expanded dramatically as the number of illnesses and interventions per patient has increased over the past 20 years. And it explains how there is different diagnoses and monitoring that's increasing because patients are living longer with comorbidities. And that adds more skills nurses need to adapt, understand, and have a continuing education on. For an example of what's currently happening now with the coronavirus, they're trying to look up new ways on how to diagnose the coronavirus faster, and nurses need to keep up with that so that they can provide that type of diagnosing to their patients as well. And then significance to patient care. It is the patient's first line of defense. So by catching or being aware of any risk factors or early warning signs that they could have, it can lead to better patient outcomes because it could be fixed or treated. Carefully diagnosing and monitoring impacts the patient's road to recovery and wellness, helps anticipate problems, their needs currently, now, and in the future, and determine their quality of care. So I had a patient who had Parkinson's disease and was receiving medication called carbidopa levodopa. And me and the nurse knew that this medication was just worsening the patient's status with the dyskinesia movements and symptoms. So we had to convince the doctor to change her medication, and by convincing the doctor with monitoring the patient's movements and documenting it, she got to replace it, the patient's medication with another medication to treat her Parkinson's disease, which not only improved her quality of care but her quality of life as well. So impact of interdisciplinary teamwork, effective documentation and diagnosis, and monitoring provides updates to others in the patient's healthcare team, especially with real-time method documentation. So it's documenting as everything is happening and monitoring and documenting that as well, and that provides an update on the patient's current status. And if there is an absence of this documentation, they don't know the patient's current status, so they don't know how they can effectively treat the patient. An example I can get back to was from competency 1 with withholding the blood pressure medication. I provided documentation of the vital signs and provided evidence that there needs to be a change of medication, and that the doctor was convinced of that. And then impact of patient safety. Nurses are the closest healthcare providers to the patient at the bedside, and in order to have patient safety, it involves good initial assessments, potential risk factors, and early warning signs inclusive complications. So an example can be given of when assessing a patient that is post-operative GI surgery, having a really good assessment to determine if they're getting worse or better. And these are my references, and thank you for listening.